make yourself comfortable a second. I'll be right with you. Okay. Right, so I've asked you to come in to see me because we've had your thyroid blood results. Yeah? No, don't worry. Don't worry. So I wanted to have a little chat with you about those, give you an examination and an ultrasound scan of your thyroid. Yeah. Okay. So we tested your blood recently and you were feeling a bit tired and your tummy wasn't working too well. You felt really sluggish and constipated and you were feeling colder. Okay, so we checked your bloods and your thyroid has shown that it's slightly underactive. So the thyroid gland is situated here in your neck, okay, and it regulates your metabolism. Now, if it goes underactive, as you can imagine, your body is going to slow down. If it goes overactive, the opposite will happen, okay? The processes will speed up. So you'll get a faster pulse, you might feel shaky, anxious, that kind of thing. So when it's underactive, your body processes start to go very, very sluggish, yeah? Okay, which is what you've been experiencing, okay? So I'll give you a check over and we will do this scan, and I think I know what we're going to be looking at here because you also have tested positive for an autoimmune antibody called thyroid peroxidase, and generally when someone has that they will have an autoimmune thyroid disease, and more often than not it develops into Hashimoto's disease. Now I know that sounds scary, but don't worry. Okay. Now Hashimoto's causes the destruction by an autoimmune process, meaning your body is attacking itself of the thyroid gland, okay? So as that starts to attack the thyroid gland, it gradually starts to cause hypothyroidism, which means it's underactive, okay? The condition is also called Hashimoto's thyroiditis. Yeah. So on the opposite end of the scale, there's a condition called Graves' disease. And some people with the antibody do get Graves' disease, and that's where the processes are speeded up by the autoimmune disease. So you get an overactive thyroid with the symptoms of Graves' disease. But I think what we're looking at with you is going to be Hashimoto's. Okay, and we can treat it, but I just want to do a full check of the things I need to confirm, and then we'll have a little chat about things afterwards. Is that okay? All right, it's not uncommon at all, okay, so don't worry about it. All right, so let me pop some gloves on. So how are you feeling today? Yeah? Yeah, I mean, sometimes with the thyroid, particularly if you develop Hashimoto's, in the early stages, your thyroid might do crazy things. It might start to go hyperactive, then underactive, hyperactive, underactive. So you'll notice that your health feels different at different times. Okay? And that may be what's been happening with you. Okay, so I'm just going to have a little feel around your lymph nodes first, okay? Tell me if anything's uncomfortable. Okay. Across your shoulders there. I'm going to place my hand across the thyroid gland. I'd just like you to swallow when I tell you to. Okay? A little bit of pressure there. and swallow. Okay, perfect. Let me just take your temperature, because sometimes with underactive thyroid your body temperature can be lower than average. Okay, so I'll just pop this inside your ear. Okay, here we go. Alright. Alright. So temperature's at 36.8, which is okay. It's a little bit down on what it was last time, but we all have fluctuations. It's not too low, so that's alright. Okay, so I'm just going to check your pulse and your oxygen saturation by popping this on your finger. Alright? Okay, let's pop that on there. Perfect. This doesn't take long. Okay. Well, your oxygen sats are fine at 98 and your pulse is at 65. Okay. I mean, your pulse may be a little bit elevated from what it would be if you were just sitting at home, so that would make your pulse a little bit low if it was that much lower than what it is now. Okay, but it's not worryingly low, so that's fine. Okay, so how's your weight been? Yeah, you started to put a little bit of weight on. Have you changed your diet or exercise regime? No, alright. Just bear in mind that an underactive thyroid will help you gain weight a little bit more easily, unfortunately, but once you're medicated, it should stabilise. Many people find that they lose the excess weight when their body metabolism comes back to a normal range, or as normal as it can possibly be. It can still fluctuate a little bit. Yeah. Okay. So let me just take a little look at the skin on your hands, if I may. Okay. Alright. Have you noticed you've been having dry or itchy skin? Okay. Could you just flip the hand over for me? Okay. That looks fine. Okay, let's have a look at this side. Just flip the hand over for me. Okay. Could you just pop your fingernails together like that for me? Okay. Right then. I'm quite happy with those hands. That seems fine. Let me just have a little look around your face, if I may. Okay. Had any problems with your eyes at all? Okay. I'm going to order some more blood work as well, and that will just be to check for any other autoimmune conditions. Have you had any soreness in your muscles or aching? Okay. Well, that can be from an underactive thyroid, but it could also be an indicator of another autoimmune disease, which sometimes does come with thyroid autoimmune issues. Okay. Common things to find, although I hope this isn't the case, are things like lupus, rheumatoid arthritis, Sjogren's syndrome. But don't worry about those things. Your joints don't look inflamed, so I'm sure it's not an arthritic condition. Okay. Right, let me just have a look at the skin around your ears. Okay. Alright. And then this side. have you experienced any vision problems at all? Blurry vision, double vision? Okay, right, what I'd like you to do is just look at my finger, okay? Right, and just keep looking there as I move my finger a second. Okay, now could you follow my finger, alright? Okay. Okay, and follow. And follow. Okay, that's fine. All right. So, have you had any discomfort in this area at all? Just feels a little bit achy at times up to your ears? Right, okay. Okay. Well, with hypothyroidism, you can develop something that's called a goiter. It's where the gland starts to swell, get inflamed. Also, nodules can be found on the thyroid as well. And obviously, I don't want to worry you, but obviously there are cases where there are cancerous growths within the thyroid, but I'm sure that's not what's going on with you. Okay, and at the moment I can't really see anything, but sometimes goiters can be very, very small. We don't want them to get big and enlarged because you end up with this huge swelling around your neck and they're very uncomfortable. So that's why I want to do the ultrasound scan, just to see what's going on there. And I'll just have a clear image and I'll take some measurements as well. Okay, alright. Been having any problems with a hoarse voice, a little bit croaky now and again, or raspy? You had noticed that, okay. And how much sleep are you getting at night? Okay, so you're feeling really tired a lot of the day and particularly afternoon onwards, yeah? But you keep waking up at night even though you're tired, alright. Okay, so you're feeling very drained, yeah. Okay, but it does vary, alright. Okay. I'm just going to have a little feel of your abdomen, alright. Just relax there, okay. Just going to have a little gentle press. Tell me if anything's uncomfortable with you. Now the nurse checked your blood pressure before you came in to see me, and that's okay, so I'm happy with that. So I'm just going to go a little bit deeper when I press now, okay? Okay, that feels good, alright. No problems there, that's perfect. Okay, so what I'm going to do next is give your thyroid an ultrasound scan. Okay, and for that I'll be using this device here. It'll just gently rub over the thyroid. Okay, before I do that I'll apply some gel. Okay, it shouldn't hurt at all, that's painless. The only thing is you might feel a little bit of pressure. Okay, and these scans are not harmful in any way. Okay, have you got any questions for me? Alright, just give me a minute, I'll get this ready and we'll do your scan. Okay. Okay, I just need to get everything set up properly on there. And then we'll begin. Okay, so I'm just going to put a cover over you here just to make sure that we get no gel or anything on you, alright? These are very gentle and self-adhesive, so just stick on there like that. Perfect. Alright. There. Just want to make sure you're nicely protected. Okay. So, This might feel a little bit cold. Okay. I'm just going to squirt a little bit of this on. Right, you ready? Okay. Just going to go on to that area there. Okay. Perfect. There we go. All good. Okay. And okay. Let's just check that's all. Right. Okay. So I'm just going to be moving this over the thyroid, okay? Up and down and around to the side. I might just ask you to reposition slightly throughout, okay? Tell me if anything is too uncomfortable for you. Alright, I'll be taking lots of different images, okay? And you'll see me typing away on here because I'll need to take some measurements and things, okay? Don't worry about that, and don't worry if you feel me going over an area more than once, okay? Doesn't mean to say there's anything wrong. Alright, just relax there, just breathe normally, okay? You ready? Okay, here we go. Alright, okay, so I can see the thyroid now. So I'm just going to be moving it up and down and around. Okay, now you're doing really well. Tell me if anything is uncomfortable. Okay. You all right there? Good. Good. Okay. Just going to push a little bit harder there, okay? Nothing to worry about. Well done. Could you just move your head slightly to the left for me? Okay, and back to the centre. Okay. Alright. Okay, and just move your head to the other side for me. Thank you. Okay. Alright, so now just going to move it up and down there, up and down, just from that side. Okay, just from there. Okay. Just feel me moving that. Does that feel okay? Alright. Alright. Okay, just one little look there now. Okay. That's wonderful. Relax there. That's all done. Okay, I've got plenty of images there. Now, I couldn't see anything wrong with the thyroid in the sense of nodules, growths, anything. It does look a little bit larger, but only fraction, I will go over all the images again, okay? But given your blood results, because she's got a TSH level, a thyroid stimulating level, which was higher than we'd like, okay, and your T4 and T3, which are also hormones that we look at when we're assessing how a thyroid is functioning, they were also showing that the thyroid is underactive as well. So the whole package with your symptoms indicates to me that your thyroid is underactive, and with you having the antibody, I am going to say that you do have Hashimoto's disease, okay? I know it sounds awful, but it's the name for the disease, so that actually slowly destroys the thyroid, but we can give you medication to keep you feeling well. So don't worry about it. It doesn't mean anything sinister, okay? It's not cancer. It's an autoimmune condition, all right? Okay. So what I'm going to do is I'm going to prescribe you some thyroxine, a very tiny dose. Okay, and this will probably need some tweaking, okay, and some very regular blood tests. I'd like to test your blood every couple of weeks to start off with, because we need to get the balance right. We don't want you going overactive, okay, because that's going to give you other problems. So we just want you to try and get you in the normal range, okay. So I'm just going to give you a very small dose. We'll get that over to the pharmacy, okay. And we'll get some further appointments booked in, and I'm going to request that you come in for some further blood tests, as I said earlier. Alright, so we'll get you in to do some autoimmune screening and another general blood count as well. Yeah, just to double check everything. Okay. So do you have any further questions for me, my lovely? No, okay. Well, you'll be regularly seeing me anyway. We will keep a good check on you at this stage, alright? Yeah. Okay. Well, you take care. Go and get your prescription, and I'll see you very soon. Okay, the receptionist will book you your next appointment.